The second kind of lens is a trifocal or a multifocal lens, which means it takes focusing from three different points. One is from the distant objects, one is from the intermediate objects, and one is from the near objects. So the aim of a trifocal lens is to try and reduce the dependence on glasses across the range of distances starting from distance up to reading. And therefore, after both eye surgeries are done, most patients come back and tell us that they now don't need to depend on glasses for their routine activities, which would mean from distance as well as reading newspapers and phones. Once again, if we measure in every eye, there will always be some residual number left behind for distance, intermediate and near. Having said that, still most patients feel that they can manage their activities without glasses. Some individuals, like even if they have a slightest residual number, do feel that for some specific activities that I do, if I wear that small little number, I feel more comfortable. So the aim of the trifocal lens is to try and reduce the dependence on glasses for most of our day-to-day or routine activities. The little gives and takes that come with trifocal lenses are that with a trifocal lens, if I focus at any distance point force of light, which means if I look at a bulb or a headlight or a street light which is far away from me and I focus on that light, I may see some rings or 2-3 circles around that light, which are typically called as halos. As those lights come closer to us, those halos tend to reduce or disappear. And most individuals, after both eyes are done, the brain gets adapted to seeing them. So 3 to 6 months down the line, most patients don't even notice that they see certain rings or halos around light. With the newer generation trifocal lenses, these are not disturbing enough to bother in regular city night driving, where there are dividers, street lights, so on and so forth. But if someone is a regular highway night driver or has to, for work or other reasons have to drive significantly on country roads where there are no dividers, no street lights, so on and so forth, those patients need to be cautious about selecting a trifocal IOL because night driving can be a little challenging in certain specific situations. Further, with trifocal lenses, when we do our near activities or our reading tasks, good lighting conditions are usually advised. So these are the 1 or 2 small gives and takes of trifocal lenses.